basements. Now, what we did is we tried to reduce the traffic from the first floor. So you have on one part of the basement, we have the radio oncology, the imaging. This ensures that we're able to manage leakages. We do not want to have patients coming to areas where we are having these oncology services, all right? Then also, part of the basement, we have parking because we'll have VIPs that come in, so they can come in from the basement and go to the top. Other service areas, like the laboratory system we have is where the lab comes to you, you don't go to the lab. So what happens is that we have a chute system from the top to the bottom of the facility to ensure that once a sample is taken on any floor, it goes directly to the laboratory. So there is minimal traffic in the laboratory, and also you do not have infection or contamination in the laboratories. I'm going to go to the next floor, which is the ground floor. The idea for the ground floor is that it serves as the entrance. There are going to be 4 different entrances for different needs. The first is the reception that takes care of everything that has to do with the first contacts. Basically, first contacts is in the entrance. Then you have the clinical entrance where you go directly to the clinic, and also the emergency entrance, and then the service entrance. Now, what this ensures is that no matter what you're coming to the hospital for, you have an entrance that is tuned, that is set for your particular purpose. The emergency, which is on the ground floor, has an 18-bed triage. What that means is that we can receive patients, 18 patients at the same time. Now, also to note, we have a helipad also. What this means is that for the international patients, for the oil and gas companies, for those working offshore, they can be directly brought into this facility. Now, also the basement, we have general clinics too. We have a cafe, coffee shops, gift shops. Basically, what the ground floor does is to be able to set the pace for what people are going to experience in the hospital. Now, when you go to the first floor, we have our clinics there. We have our dental clinics there. We also have some of the dialysis over there. Now, we looked at it from traffic increase. So the highest traffic is on the ground floor. You go to the first floor, lower traffic. The second floor, less traffic. So by the first floor, we have our specialist clinics where you have the big 4, and also you have some of the procedure rooms. Now, as you go up to the second floor, what you have in the second floor are those highly specialized services that also need their procedure rooms. That's why you have the nephrology, you have the endocrinology, you have the rheumatology, you have the orthopedics. So those specialist clinics are on that floor. And also you have, of course, the IVF clinics. So the IVF is also on the second floor. The idea is we design the place such that if you come for 2 different consultations, you might not need the next person. So we have different areas where we have different waiting rooms. So if I come to see the cardiologist, I might not see someone that comes to see the pediatrician or someone that comes to see the rheumatologist. We have shared services, but we also sequestered the patients to ensure that the experience is not like a hospital. You do not feel you're in a hospital. The privacy is also retained. Now, on the third floor is where we have all our administrative services. So you have the C-suites, we have the training centers, we have the halls. So basically everything from patients support, everything comes to the first floor, to the third floor. So on that floor, that's where the CEO is going to be, the C-suite, everything about procurement, everything about third-party, HMOs, international HMOs, partnerships, everything happens on the third floor. The idea is once you go past the third floor, everything above that is purely clinical. Now, the fourth floor is the interesting floor. The fourth floor is divided into 2. We have the critical care area and the theaters. Now, they are put on the same floor to ensure that we can move patients in between. Now, we have about 10 theaters in this complex. The first, we have the robotic theater, fully automated robotic theater. We have our transplant theater, our neuro theater. We have our orthopedic theater. Now, our neuro orthopedics, those are our sterile, super sterile theaters. Then we also have our general theaters. We have an emergency theater and also our cath lab. Now, the idea is for that particular place to serve as a training center also. So we are going to have hubs so that, such that doctors and other staff, other members of the team can, in a room, view everything happening in all the theaters, because we designed it with a training and research capabilities mindset. Now, at the other end of the floor, that's why we have critical care. At the other end, we have the critical care. So within the critical care, we have the intensive care units. We have hubs for that. We have private hubs for that. We have the pediatric intensive care units. We have the HDU. We have the cardiac care centers. We have the NICU. So the idea is for an exchange between the theaters and the critical care area. And if a patient goes critical, it can be moved back to the theater. So that's what we have on the 4th floor. Going over to the 5th floor, the 5th floor, 5th, 6th, and 7th are basically wards. Now, of course, when it comes to wards, we have different kinds of wards. We have our semi-private, we have our private, and we have our VIPs. Because we'll have those that really want to have their privacy and want to have their comfort. So we have them on the 7th floor also. Now, note one thing. Each floor is self-sustaining in that they have their own call rooms, they have some consulting rooms, they have their procedure rooms on each of those floors. For the 8th floor, what we have there is the wellness center. So for the wellness center, those that are not really ill but believe that they need to rest or relations can also stay there. So that 8th floor serves for the high-end patients that can come in from the basement directly and go up there, really need high-end privacy service. That's what that serves for. And of course, a wellness center. We understand that healthcare has gone past curative. We are now looking at preventive. And now it's not about, I am not ill. The point is, let's make sure that we are all healthy. Next slide, please. So this is the spread of the beds, where we have the different kinds of beds. We also have a bonds unit. I didn't mention that. We have a bonds also too, because that's something that has really been overlooked, where we have our bonds bath and everything. So we can manage patients even from the plastic, bonds and plastic department also. I forgot to mention that. So that's the bed spread, and so you can see based on all the floors where we have the beds. Next slide, please. So now, what is the structural and what are the highlights, the structural and the architectural highlights? First is, I wouldn't want to bore us because this is more of an engineering thing, but we have integrated basement vaults. The idea is to be able to capture everything that uses radiation to the basement and also reduce traffic to those areas. Then, of course, we have a facade. It's good for us to understand that even though we're in Africa, we can do better than those in Europe. So the building is made to be as nice as anything you can find anywhere in Europe. And of course, a lot of environmental considerations. That's why we looked at the ESG in terms of having a solar farm there to provide clean energy to this facility. Now, when it comes to MEP, we have 5 elevators. We have 1 elevator for service. We have 3 for patients and people. Then we have another for clinical service. So the clinical service ensures that if a patient is in a ward and you need to go to another floor, you do not have to interact with the public. And of course, service floor ensures that management of the operations can use that to go through all the floors without having to inconvenience the patients. And of course, we have backup power. So basically, we have backup to the backup to the backup. What this means is that even though we have NEPA, which we commonly have, which we commonly do not have, sorry, we also have generators to back up. And we also have the solar farm to back up. Now, even the systems also have their own backup. So what this means is that the chances of us not having power there ever is truly, truly slim. It's truly slim. I want to maybe say that it will be similar to government house, if I'm permitted. We will never have downtime. Amen? So now, what's the delivery model? We are using an integrated EPC approach. What this means is both the procurement, the engineering, everything is put together. So we have the team, we have the OEMs that are working on this project. So different teams, different OEMs, the best are going to be a part of this. Now what this means is, even post-commissioning, they're going to be a part of this. So it's not a contractor kind of arrangement. It's where every OEM comes into the system and takes responsibility throughout the course of the project and also beyond. Not just in maintaining the equipment, but also ensuring that our people are also trained on how to manage these equipments. Then of course, there's going to be a project management office post this, because like I said, it's important that the system sustains itself. So if we have a PMO managing it for 3 years, we are sure that before locals understand the system, we are going to be able to be self-sustaining. Then of course, let's go to our 18 months project plan, please. Now, when we saw this 18 months, we understood that the state was very serious about this. 18 months is actually a stretch. But you see, the beautiful thing that I found out in my years of project management, it's not about the impossible, it's about the will of the people. It's about the will. And when I was first introduced to this project months ago, I always said it, everybody that has been part of this project has really had the will. His Excellency has the will, Honorable Commissioner has the will, every member of the team. And I mentioned the last time that this is the first time I've seen any project in Nigeria that when we came into the project, it was as if they knew exactly what they wanted. And that is great. That's something I commend the delivery team on. I really commend them on that. So even though it seems daunting, I believe it's something that can be done from what I have seen. We have assessed it, we have looked at it, and we believe that together, with an engagement like this, together, in the next 18 months, we all will come together and will cut the tape and will be glad that such a facility is in Akwa Ibom State. Now, what's our post-commission sustainability plan? Like I said, it's not just about setting up a facility. We have to look at it post, after the commissioning, what next? And that conversation started with, one, there has to be operational continuity. What that means is that the OEMs and everybody being a part of the project is going to continue. They're going to continue after commissioning to ensure that there's no downtime. It's going to be a sequential handover, not just one handover, right? Then also, we're also looking at the clinical capacity. His Excellency has committed to the training of 100 clinical and biomedical staff in the state. I think you need to put your hands together for him for that. Now this is not local training. We are talking about international training. We are talking about training that is going to ensure that the skill set to manage that facility is going to be available locally. And in fact, the training is going to start 6 months before the commission of the project. So the moment the project is commissioned, we have people on ground that can manage the MRI, that can manage the brachy machine, that can manage the robotic. Now that to me is a leader that is thinking of the future and thinking of what's best for his people. And of course, one other thing we thought about is, it's not just about having a beautiful facility with all the equipment. You have to look at it from the perspective of how are these things going to be managed? How are we going to manage the clinical care? So not just the training, we're also having partnerships with international hospitals, international training firms to ensure that we have the expert support, not just in management, but also in training and also in research. Now, a couple of things we looked at. Whenever you handle a project, the first thing you think of is, what are the risks and how can you manage these risks? And we looked at the key principles risk that could affect this project. And we're able to go through them step by step to ensure that we mitigated them, and we made sure that the team, the training which we are going to put on ground, will ensure that this is done properly. Now, interestingly, the socio-economic impact. It's important to note that this project is going to bring, this facility is going to bring into the state nothing less than 15 billion naira every year. I think we need to put our hands together for that. Because this 15 billion that comes in is coming into the state. And it's not coming from the states. It's going to come in from international, West Africa, and Nigeria as a whole. So what this means is that we are going to have allied businesses. People are going to be employed. We're going to have supply chain. And because this project is one out of many other projects that's going to take place in the medical city, it's going to expand on what is understood as healthcare in Nigeria. And of course, there's a social impact. We need people to understand that you do not have to travel for all this. It's available here. Like I said, it's no longer reducing medical tourism. We're now reversing medical tourism. We're not trying to say people do not go outside. We are trying to say that, look, you can, rather than go, those outside are coming to Nigeria for care, and that's what we stand for. That's what this hospital will stand for. So interestingly, now the training schedule. You see, this training schedule is actually a summarized one, because the training we are going to be putting together, it's not just we. We have a university in the US, we have some in Turkey, we have some in Europe that have indicated interest in training across the specialties. Now we are talking about the robotic training, we are talking about the radio-oncology training. You know, what happens is that they keep complaining, most of the OEMs, that when they have a machine, when it comes to Africa, we barely use 30–40% of the capacity of the machines. And that to me is a disservice to the investment and also to the people. So for us, it's important that we look at the complete spectrum of what is possible. And we say to ourselves that, look, it's not just that we do not have the expertise. Whatever it is, we will learn it and we'll give it to our own people. So we've looked at the training from the perspective of the machines and also facility management. Because I've had the experience where most of the time it's not about the machine, it's something as simple as learning to switch off some lights or some ACs when you're leaving. Shut down the machine properly. So such trainings are going to be part of what we are looking at, because it's not just about local capacity. We want to be able to compare internationally. So the commitment from the project team is that there's going to be a delivery. We are delivering a world-class hospital. Now, when I say we, I mean we in terms of everybody that's going to be part of it. In fact, everybody in this room is part of this we, because it's not a one-sided thing. We are all working on this together, including those in this room, the OEM, from the government, other stakeholders. It's open for that level of engagement to ensure that the facility is one that we dream of and we wish to see in the state. And of course, rigorous project management. It's important that we work together as a team, because 18 months is short, but it will be delivered in such a way that it will become the standard for what is expected for healthcare. And of course, sustainability, that is very key. We have to make sure that the post-commissioning period is such a way that the hospital can manage on its own. The hospital is going to be run as a private hospital. It's not going to be run as a public that is just there as government invested monies and is disappearing. In fact, I'd like to digress a bit. You see, this is also the first time in my 18 years handling projects across Nigeria. I think I've worked across Nigeria, across all the IOCs, and this is the first time when we are considering a project and the client says, develop a business case. Now, His Excellency's foresight is quite commendable. He's not looking at the project as one where it is something to just cut a red tape. He's looking at it in terms of, if we invest in this project, does the state get back its fund? And so when you have that kind of mindset, it means that for the state to get back its fund, it means that the facility is functional. The facility is working, is providing value. Because without providing value, you don't get paid. So it's really commendable that we looked at it from that perspective in terms of, is this facility going to stand on its own? And I think the answer has been a very big yes. So what's the value to the healthcare community? Firstly, enhance clinical capacity and patient care. Every doctor, every healthcare professional, you want what's best for your patients. So you can be sure that this facility ensures that the patient gets the best care available. And of course, training. It's important that we engage at this stage, because I think shortly from the Ministry of Health, there will be a list set up for those that will go for these trainings to ensure that as we are finishing, the facility is going to be handed over to people that can actually manage these machines. And of course, research and collaboration opportunities. The conversation with the training universities and training hospitals is such that it's not just a one-way thing where they just come and train us, but it's also going to be a situation where there's a collaboration for research, for publications. So the conversation is going to go further than just this project. And of course, operational excellence and then community impact. It's important that this facility, it's in Akwa Ibom State, but it serves internationally and also Nigeria. So for the Ibom International Hospital, this is just step one of what His Excellency has in mind. Next slide, please. Now, this is the medical village. This is the future. The idea is that it is going to be a public-private sector-driven intervention. It's not a political statement. It's something that will work. So the Ibom International Hospital is first out of other things that is going to build an ecosystem for which we are all going to benefit from. Thank you all for listening. Thank you all for engaging. And I hope you work with us on the Ibom International Hospital project. Questions? Okay, all right, thank you.
Ladies and gentlemen, can we please once again applaud Dr. Tenye Isokarie. Please, can we all once again applaud His Excellency, the Governor of Akwa Ibom State, Pastor Umo Basieno, for this fantastic vision on healthcare delivery in Akwa Ibom State, the Ibom International Hospital. While the presentation was ongoing, the Commissioner for Health whispered to me that in a matter of time, very, very soon, His Excellency, the Governor, will be flagging off the construction of the Ibom International Hospital. And listening to the gentleman there, I am sure that your minds are made up to believe that this is a worthwhile health investment that the state government is pursuing. Please once again applaud and appreciate His Excellency, the Governor of Akwa Ibom State, Pastor Umo Eno. Distinguished guests, ladies and gentlemen, we're still here for the Arise Health Sector Town Hall meeting. I told us at the beginning that this is an assemblage of stakeholders in the medical sector of Akwa Ibom State in line with the vision of His Excellency, our dear Governor, Pastor Umoina, who wants to ensure that every Akwa Ibom person has access to quality health care in Akwa Ibom State. We'd like to bring up for the next presentation now the gentleman who serves... Yes, Commissioner, please.
I think there's a change of plan.
Okay.
Let's take comments here so people don't forget what they've listened to.
Okay.
And then we can then progress to the next. Let's make it as interactive as possible. Otherwise, the aim would be defeated. We want people to contribute now that it's still at the concept stage that we can adjust things and all of that. So I think we should invite questions, comments. Yes, please, Dr. Isokarie, would go back. If I need to come in from the ministry perspective or come in from here. Thank you. Okay,
Doctor, please, could you come up here? Gentlemen, contributions, questions. Would like to see some hands. Doctor, please, there's a hand there. Just tell us your name and keep it very brief. Perhaps just 2 questions per person. Your name and your organization.
Thank you very much. Please, because of want of time, permit me to stand on already established protocol. My name is Comrade Effiong Onoikeru. I'm a nurse from University of Uyo Teaching Hospital. Please, I really want to appreciate the state governor for his vision in health sector, especially to develop the state health sector like the one we have outside the country. I want to make some contributions and suggestions concerning this Ibom International Hospital. The first one is, so according to your presentation, in your design stage, I've seen some suggestions that I would like to put across. The problem we have in the health sector is that during planning stage, some stakeholders, service providers, other professionals are not consulted during planning. so that at the end of the day, you will see some basic things like office space for offices, especially those of us that are nurses, like offices, call room, changing room, and other things, facilities. Those basic things are not there. You may have a very fantastic building like this, but when you look at it, when you enter that place, at the end of the day, you will not see. Because end users, let me put it that way, were not consulted during planning and designing stage like this. So I don't know. It's good to have a very beautiful edifice, and in terms of structure, I don't know if those stakeholders were consulted during the planning stage. That's number one. I also want to look at your design. During your design, you made mention of fourth floor that is designed to be a super. You said the fourth floor would super sterile floor. But I can't. After having that on fourth floor, you now have what on top of super sterile floor? That's supposed to, as you call it, super sterile floor. So I don't know if that is what is obtainable elsewhere or in the wall. So that I want you to put more clarification on that.
That should be the end.
Please, I have a very important one, training. I also want to find out, because I really appreciate you. You also put your training module very well, fantastic. But we discovered that in the health sector, during training, some other healthcare professionals are not also carried along during training. So that, and you will train a medical practitioner in this area. Please that's the end. Let me put it, I want to make a point. You train them, like personally, I'm a peri-op nurse. As a peri-op nurse, you will train a neurosurgeon in a particular area, and with all those equipment, and you expect me, a peri-op, to handle surgery for that person, but I'm not trained. Please, I don't know if you have developed your plan of training to carry other professionals along. Thank you very much.
Thank you very much. We'll take just one more. I can see Dr. Just come forward, sir. Come forward, sir. Please work with me. Please come forward. Come forward. The gentleman there on the pink shirt is a medical doctor. Yes, please stand, sir. Yes. We'll take his comments, and then doctor will respond, then we shall continue. Please, sir.
Thank you
Just
very
in a
much.
minute.
My name is pharmacist Ikemeset Udo from the University of Uyo Teaching Hospital. I have listened carefully at the presentation. Fantastic. But I want to ask a few questions. Number one, what is the plan for pharmacy in this building? Are we doing a centralized pharmacy service, or we are doing decentralized? In the current setting, pharmacy outlets are supposed to be on each of the floors to cater for every patient that is being attended to at this facility. But during the presentation, I just noticed just one pharmacy that was mentioned on the ground floor.
Thank you.
Thank you very much.
Thank
and
you very
also
much.
in the trainings, pharmacists should be included so that we can have best for our patients.
Okay, please, just to guide us going forward, the gentleman will speak about trainings generally as covering everyone, so that everyone doesn't ask training for his own unit. Doctor, please.
All right, thank you. You mentioned your first question, so the gentleman over there, the nurse, your first question was about stakeholders, and I think the Honorable Commissioner mentioned that the design, every department was called in for that design, and I can confirm to you that that's the case, because when I came in, the brief we got actually had input from all departments. And trust me, my mother was a nurse for 37 years. I'm biased towards nurses. Forget I'm a doctor, but I'm biased to nurses. So don't worry, you're in good hands. Then when it comes to wards above theaters, you see each floor is a unit on its own. The way it's designed that even though we are stacked from top to bottom, each is a business unit or is a functional unit on its own. So you see every floor, that floor is not a sterile floor. What it is, it has dirty, clean, semi-sterile, and sterile areas, all right? So what we did is that we are looking at patient transit time, and we, as much as possible, do not want people to go past the floor where they need to go, okay? So when we say that floor is for the theater and CCU and the critical care, the idea is that once you come into that floor, you're coming into the dirty. Then you now transition, of course, through either change of your shoes, change of your clothes, from the dirty to the clean, to the semi-sterile, to the sterile. Now, the hyper-sterile areas are those places where you have like orthopedics, and you have neuro, and you have ophthalmology. Not all theaters are going to be hyper-sterile, because for it to be hyper-sterile, there are some functional and structural changes, and also operational changes that ensures that you do not pass infection, of course. Then, of course, training of medical professionals. You see, if you hear what I didn't say training of doctors. I said medical professionals and biomedical engineers. So I didn't mention doctors. So trust me, the reason why everybody's brought into this is because we all have a part to play. And so the training, the research, everything I say, it's about the medical community, not just the doctors. Hope I was able to touch on that. Any other thing, you can meet me outside so that other people can also comment. Then for the pharmacy, yes, I was trying to rush through this. Probably when we meet outside here, we can break it down. We have a decentralized pharmacy. We have one pharmacy department, but we have different levels with dispensaries. Now, the way the hospital is designed, we do not want patients to come to service. Service goes to the patient. Your drugs go to you. Your treatment goes to you. So that's why on every floor, we have dispensaries. We also have phlebotomy rooms, sample collection rooms on every floor. So the service comes to you. You don't go to the service. That's why we have the whole pharmaceutical department in the basement, because we assume that a lot of traffic is going to come in to deliver. There are different levels, of course, the poisons room, the preparation room, everything is done in the basement. So yes, it is decentralized, but also we can take this conversation outside here. Then, of course, pharmacist training, I believe I've answered that. The training is across the healthcare spectrum, not just doctors. Can we take the next batch?
Ladies and gentlemen, please, we'll take 2 more questions. Let's go to the right side of the aisle. Just the lady here, start from the beginning, and then we'll take a gentleman further down. Just 2, please, because of time, please. Please. Other contributions, you can write it down and then hand over to the gentleman who will take it to the doctor, please. Madam.
Thank you very much. My name is Dr. Eno Atta. I'm the Executive Secretary at Akwa Ibom State Primary Healthcare Development Agency. Thank you for your wonderful presentation. It's really inspiring, for us to look at and say it's actually possible here in the state. I just have 2 questions, real quick ones. You talked about the planning stage, bringing all the, I think it was the Honorable Commissioner that talked about that, bringing different medical professionals together to talk about what this dream would look like. But I also wanted to know, is there anything that is database statistics for the need for the subspecialties that are being reflected in this IBOM's international center? So that's one. I'm looking for data or statistics that will draw people. I can see that it's not just going to be about the state; it's going to be about others. So and then also, marketing. I hope that there's a plan in place, or there's a spot for marketing to be there. I know when we were growing up as medical students, we weren't really supposed to market so much, but this kind of facility needs people to know that it's there. So let's look at the marketing as well. Thank you.
All right. Okay, while the next, can I go ahead? Okay, all right. Yes, data-driven need, you actually mentioned something very key. You see, I mentioned it previously, accessibility to quality healthcare is a major problem. And so when we are looking at the markets for this hospital, it's not just Akwa Ibom State, it's not just Nigeria. We're actually looking at it internationally. So this facility is a mix between a tertiary and a quaternary hospital. The idea is to provide those services that you cannot receive locally. So when we talked about specialties, basically it touches all specialties. Of course, we can't really go in depth into all of them in a meeting like this. Probably we can have this conversation later, but it cuts from orthopedics to IVF, from let's say rheumatology, all the way to pulmonology, right? So it goes across the spectrum. The idea is that it's meant to be it's a network, and this hospital stays in the middle to ensure that the referral system across the state, across the country, feeds those specialized needs to the hospital. So yes, it is data-driven, but the data is much more than the states. So it's on a higher level, yes. Then of course, marketing and branding. You see, there are two kinds of marketing. We've had this problem over a long time. Now, there is value-based marketing and there is a need-based marketing, right? So when we are pushing this hospital, we're not trying to say, oh, Ibom International Hospital, a lovely place, come and get it. No, we're the best. No, we don't want to say that. We are saying that, Oga Senator, you see that 20,000 pounds you want to spend outside. That thing they want to do for you here, we'll do it for you here at 5,000 pounds. So we're just trying to say that it is available, it is possible. That's what it's about. So you see, when it comes to accessibility, that is the problem we have. People do not know that these things are available, and we are making it possible. Do we have, there was one other, okay.
Please come, sir. The
Ubon,
member in
let's
the
do it
state
this way so that we
constituency.
can take the other presentations. All those who want to ask questions, let them approach. You give numbers, we quickly take, and then we can make progress.
Okay, while they're coming, please take the microphone to member representing in his state constituency. He has some questions. Please, the others that have questions and contributions, just 5 of you, please. The Honorable Commissioner says 5. We have 2 here already.
Also,
3 more people, please.
Okay.
I'm taking note.
Thank you. Good afternoon, everybody. My name is Lawrence Udoyide, and by the grace of God, member representing in the state constituency in the Akwa Ibom State House of Assembly. First, I want to thank His Excellency the Governor for this town hall meeting. The Governor would have gone ahead to put up the facility without consulting people, and nothing will happen. I think for the Governor to come to this extent of assembling stakeholders to hear, to get input from them, I think he deserved a very wonderful round of applause. Having said that, in the course of your presentation, sir, you did mention that is either the basement or the first floor will have what you call coffee shop and gift shop. I understand the aspect of the coffee shop, but what is the idea behind having a gift shop in a facility like this? Thank you.
Thank you, Honorable. Thank you, Honorable. You see, as part of, sir, as part of the healing process, right, it's important that your loved ones come and show you that support and that love, right? So if somebody I know is in a hospital and I'm going there, I should be, if it's a child, I want to buy like a small teddy bear. I want to buy a card. I want to buy a flower. So that's the essence of that gift shop, to be able to show that love that verbally you can't show. And I know in Nigeria, we like black tax. So once you come in, they put a box where you contribute for care. But so even though you're going to contribute for care, we just want to give people something to physically give to their loved ones. That's the whole idea.
let me also add, one of the ideas, the gift shop, we specifically requested for it because His Excellency wants us to replicate the kind of care you get abroad. So we have raffia artifacts produced at Ikot Ekpene, and we have a lot of cultural things that are produced here in Akwa Ibom. And you're putting together an international hospital. The idea of a gift shop where international patients are able to take something home and say, oh, I got this from Akwa Ibom. It is another idea of cultural exportation. So I don't know whether you follow. So therefore, people who come in, let's say from Togo, from Cameroon, our neighbors here, to access care, they can take some raffia products, which they will take home and say, oh, I got this from the Ibom International Hospital. In many hospitals in Turkey, and many of us here have been privileged to access care around there, Turkey, Germany, and all of that. They even have malls at the balcony where you can get stuff from. So the gift shop is not a shopping mall like Tropicana Mall, where people around drive to there, but it is the idea that this is an international outlet. When our visitors come for care, not only should they experience care, there should be that cultural immersion where we export the Akwa Ibom culture to the world, and we have a lot of them that can be exported. Even the interior designs for this hospital are culturally themed. So I want us to understand that. Thank you.
Thank you very much, Honorable Commissioner. Gentlemen, we have 9 people here to ask questions. I'd like to inform us very respectfully that we have 7 more presentations to go. So you just keep your questions very brief, just mention your name and ask only one question, please. The gentleman will respond. While we're getting ready for that, please permit me to acknowledge the arrival of the Chief Medical Director of the University of Uyo Teaching Hospital, Professor M.M. Bassi. He's here with us. Thank you, Prof. And former Commissioner for Health, Akwa Ibom State, Dr. Prof, we're delighted to have you here. Thank you so much. We have here in our midst the former Chairman of the Nigeria Medical Association, Professor M.M. Abraham. She's there. Please, a round of applause for her. Thank you so much, Prof. And also the Senior Special Assistant to the Governor and Personal Physician to the Governor, Dr. Osenebo Morgan. He's here with us. We welcome you, Doctor. Yes, please. Sir, your name and just a question.
Okay. I'm Dr. Nyekan Peter, Chairman, Nigeria Medical Association. One comment and then the question. I want to beg us to
just
use
a question, please.
A multi-investment model for this hospital. For instance, the lab can be run by a separate company. The radiology department, somebody can bring a CT scan and run it so that everything does not go into maybe only one investor or the government running it. I feel that this model will be better for the hospital and the state. I also did not hear anything about the green areas, where we are going to do the fields and gardens in the hospital. We want to make it eco-friendly, so we should also show the designs from the beginning. The landscaping, the trees, everything should be taken into cognizance. The maintenance model and the cost to the people of Akwa Ibom State. Is Arise Care going to be able to subsidize for this hospital? That's my question.
Yes, Doctor, please.
Okay, all right. Yes, the multi-investment model is something that we have looked at, but usually what happens is it's difficult to synchronize, right? It's difficult to synchronize. We've had hospitals that have tried that, a lot of teaching hospitals, and it has been a problem, right? Because one, the capital investment is usually heavy, and so the private company is purely profit-driven, and so the social aspect of governance is taken out. So we are trying to create a balance between the social and also profitability. Then for the green area, yes, we have 2 healing parks, right? We have a bigger healing park where you can go sit down, greens all through, just to relax. Then there's also the other green park, the healing park, where patients can use for their physio to walk around too. So one is just for relaxation, and the other is actually part of management. Yes, so we are very green on that.
Okay,
Then,
Doctor, please, we'll just take about 3 at a go to serve time.
Okay, all right.
I saw you take notes earlier on. I know you do so. Gentlemen, please, just your name and a question or contribution.
Okay, the Honorable Commissioner for Health, members of the public, my name is Akpan Emmanuel Peter. I'm a medical lab scientist. All right. Having listened to the design for the Ibom International Hospital, I noticed that there is no emergency exit in that particular design. And also, fire service units should be. It's just an observation. Thank you.
All protocol duly observed. My name is Promise Sambu from Teaching Hospital. Please, I really want to ask this question because it's really important based on the economic challenges in Nigeria these days, and which has caused so many of our people in the rural areas and some villages, the poor people don't have access to medical health care based on their challenges financially. And looking at this, looking at this design, it looks so costly. But my question is, will it be accessible to the less privileged, the poor and the poorest people from the village? Or is it for just the celebrities or people that comes from so that at least they can have access, because looking at it, it looks so expensive.
Thank you.
Good afternoon, the Honorable Commissioner.
Thank you very much, gentlemen. Please, can we have some decorum in the hall so that we can also hear this gentleman's contribution, please? Thank you.
Good afternoon, the Honorable Commissioner, sir, and members of the High Table. My name is Ubong David. I am a dietitian with the University of Uyo Teaching Hospital and the State Chairman, Dietitian Association of Nigeria. Now, considering the importance of nutrition and dietetics to health, and in the presentation, I didn't hear anything concerning a well-furnished dietetic kitchen and unit in the presentation, and that should be part of the structure that should be put up in issue, because in nearly all the places I've visited in the state, I've not seen dietetic kitchens, and that is a very big limitation.
Thank you very much. Doctor, please respond to the three, and then we'll take others.
All right, thank you. I'd like to start with the dietetic kitchen. Yes, we do have that, but being a stakeholder setting, I think based on your position, I think after this, we'll come together, we'll look at what we have, and if you have any comments, we'll work on that. Is that okay? Then emergency exit. Yes, we have emergency exits. I just mentioned the 4 big functional points. The reception entrance, the clinical emergency. It can't just be 4. That hospital is too big to have 4. We are going to have emergency exits, definitely. And of course, fire, yes, we have fire control automated. The whole building is automated. Basically, you can manage the building from your phone. So everything is fully automated. So yes, we have that covered. Now, the interesting one, is it going to be affordable? Now, let's start from this, right? You see, the first thing in healthcare is it possible? I have this problem. Can I be healed? That's the first question. Now, the hospital is seeking to solve that problem. So it is possible, right? Now, let's go to the next thing. You see, one of the key things, when I mentioned about His Excellency looking at it from a business perspective, what he was trying to do was to justify it, justify the investment. Of course, government has a social responsibility. He has a fiduciary duty, yes, but there's also a social responsibility. So, you see, what the training is going to do is such that the people that train in that facility now have the capacity to actually spread these services outside that hospital to other hospitals. So what this does is that it serves as a nexus where this capacity, these trainings, this talent comes into the states, then from there it spreads out. So we're going to have consultants from the other hospitals come in there, get training, and still go back to those other hospitals. So the idea is not about price. It's about what does the place serve, what does it stand for? It stands for an entry for knowledge and talent. Now, when it spreads across the states, yes, it will probably get cheaper. Now, forget it's saying international hospital. It's not going to be as expensive as we think, because the way the service is going to be arranged, those that want to pay the high end have a place for them. We have a place for them. Then those that can manage will also have a place. But let's get something clear. Healthcare is not cheap anywhere in the world. It is not cheap, right? Let's get that clear. As much as possible, the design will make it affordable, but it will not be cheap because we have to pay the professionals. Thank you.
Okay, the next.
And just hold on. the delivery advisor has some comments to add.
Thank you. When it comes to affordability, that's always a very topical thing that everybody wants to know. But we've started in the state, one area that we are directing our minds and we need to key in carefully, and that is the area of health insurance. Even as we speak, many people in this state are able to afford services that they otherwise may not have been able to afford because of the health insurance that has started. And this is in phases. There will be a phase for health insurance that will give you greater packages, better benefits, depending on what your subscription is. And I must tell you, during our visits, exploratory visits to hospitals of similar nature in Turkey, it was clear that the bulk of the people who received care from there never had out-of-pocket payments. They all pay through their different insurance companies. Already the ecosystem, the health ecosystem, is beginning to accept insurance. And that's very good for us because going forward, we'll be able to move step by step in different levels that would ensure that people can access care at whatever levels you want because you have keyed into an insurance service, in addition to what government will provide. Thank you.
Okay. The Honorable Commissioner, thank you very much. Distinguished members of the head table, distinguished guests, ladies and gentlemen. My name is Kufre Hussein, a nurse working with University of Uyo Teaching Hospital. Please, I want to make one observation and a question. My observation is this. You cannot count 3 without counting 2. Having worked in the accident and emergency department of University of Uyo Teaching Hospital for some years, I've been seeing patients come in with ordinary fever, headache, malaria, and everything. Here in Uyo, we do not have a secondary health facility owned by government. We have not, and looking at the Akwa Ibom State.
Sir.
Yes.
We'll come to that. This presentation, the program in the overview, okay. I had highlighted that when we talk about hospitals management board, that is where your question comes to. And the PS would answer. This question, he cannot answer. He is the consultant for Ibom International Hospital. So if that is the only question you have.
No, let me learn.
Please ask a question on this hospital.
Question on this hospital is, to what extent have we explored Ibom multi-specialist hospital that is already on ground that we are going over to this other one? And do we have the manpower to do this thing? We've not trained enough hands to do this. How do you buy a car without having a driver? Or you want to train a driver after you bought a car? I think we should go on training. We should train, we should employ, we should have hands before we do this.
Thank you. So I think that question is for me. Let me just answer. Because firstly, sir, you can actually buy a car without having a driver. And many persons have bought cars and they did not have drivers. Some of them are in this hall. Again, the owner of the car can also be a driver. So just like me, I am a driver and I own a car. Well, the CFD has said on air, live on TV, that I'm physically challenged. My lawyers will write to him. That was on a lighter note. So, my brother, first of all, let me actually, we expected this question. So when His Excellency came, and if you recall, and you go through the Arise documents, the governor made copious mention or mentions of his intention to revamp the Igbo multi-specialty hospital. And so the first thing he did in his first year in office, he constituted a technical working committee headed by my predecessor in office, Professor Augustine Umor. As PPG, then, as I then was, I was a member of that team, so I can speak to it. We did our evaluation, and we found out that there was so much work left undone in that hospital that needed to be done. But not a problem. We came together, we brought in professionals from Port Harcourt, Lagos. The cost was assessed. And we were scared as a committee that this cost is humongous. But when we presented it to the governor, it was like, is this why we cannot fix this? We'll fix it. And it went to the House of Assembly, was put in the budgetary provision. So that's, I have taken this time to say that that demonstrated good faith. But just before implementation, we were scouting for a veritable resource person. And remember, we decided to say, okay, let us go to Europe, from where the original builders of those hospitals came from. And they came around, and we said, the governor commissioned a European team from Turkey and Germany to do an audit. And when they did the audit, the findings were damning. As we speak, it turned out that the cost of fixing that hospital will be more than the cost of building a new one. That was the first thing. The second thing is the design of that hospital, the intentionality of government was to make it a quaternary hospital that was truly international. And when you call hospitals international, it's not because I built a 3-bedroom flat and I said Ekem International Hospital. It is because it meets international standards, JCI accreditation. And so we found out that the design meant that even if we put all of that money there, we would not be able to secure JCI accreditation because some places were either too small and others were too big. Now, those were the issues. So if we wanted an international hospital, it was clear that it wasn't going to be that. So what is now the approach? The approach now is that Igbo multi-specialty hospital is not abandoned. It is in the budget. It is a different project from the international hospital. And so both of them would exist in pari passu along the medical corridor. And so have no fear that it has not been abandoned. It was just to achieve the aim that we truly want a hospital that can reverse outbound tourism and drive in inbound medical tourism. So it will continue to, Igbo multi-specialty hospital will continue to exist to serve specific purposes. So for now, that is the summary. Let me also talk about training. So you spoke about training. I think the consultant dwelt extensively on training. He went as far as talking about the medical professionals and even biomedical engineers that will be trained. And beyond those who will go outside for training, he emphasized the fact that the operations of the hospital itself will further do local-to-local transfer of skills and knowledge. 2 months before the commissioning of the hospital, all the OEMs will be in Akwa Ibom to take people every single day for 61 days on the training. So this hospital is going to produce biomedical engineers, not only for that hospital itself, but for our general hospitals and even for the UUTH. Because we invite them to send people to benefit from all of that. So there is no cause for alarm concerning training. We have overflowed the issue of training. Training is part of the project. So thank you.
Thank you very much, Honorable Commissioner. Ladies and gentlemen, please, we're trying to wrap up this session because we have 6 more presentations. Before I invite the lady to ask her question, please, Honorable Commissioner, permit me to make this announcement. The driver with the vehicle with number plate DRK 116AA. I'm told you are blocking access to someone who needs to take his vehicle out. Yours is a Toyota Matrix. Kindly repark immediately, please. Your question, ma'am.
Thank you so much, sir. A very special afternoon to the personalities and all professionals here present. I am Ine Mukbang, a physiotherapist, chairperson at Akwa Ibom State Civil Service Employed Physiotherapists Forum, also the head of department, General Hospital, Equator, Oron. Please, sir, I want to be enlightened on why physiotherapy department, as one of the vital departments, was not listed in the basement apartment or in the basement floor of the hospital, being that physiotherapy has to deal with curative and preventive measures. In all the listing of the vital departments,
the point has been made.
Was not.
The point has been made.
Was not.
Okay.
Was not listed. I want to also be of the opinion that when trainings are to be set for professionals, physiotherapy, which has 8 or 9 distinctive departments, should also be enlisted in one of the. Thank you, sir.
All right.
Thank you very
madam.
much. Please, I'd like to appeal to everyone to please help me to hasten this session. This is some minutes after 3, and we have 7 more presentations to go. No further question on training, please. That has been handled. Just make your point and drop it. Thank you.
Thank you, everyone. My name is John Paulo Bin Naona from University of Uyo Teaching Hospital. And like my colleague said, I know that in a standard hospital, physiotherapy department is set, the setting is close to the entrance with ramp and to facilitate good movements, good access. And then, apart from the monies generated from inpatients and outpatients, there's also more money generated from well-equipped gym from healthy individuals. I don't know if physiotherapy gym is structured too in this international health hospital, please.
Thank you very much. My name is Anyekere Kanem. I'm a doctor in the University of Uyo Teaching Hospital. One of the challenges we have in the health system here has to do with management of healthcare waste. I'm not sure I heard you mention anything about that. What's your plans to address this in the hospital? Thank you.
And finally.
Thank you very much. I'm Asuku Anuka. I'm an infectious disease physician. I just want to make some inputs because you talked about the isolation facility will be with some other facilities at the 5th floor, if I remember correctly. What floor, sir? 1st floor?
And ground floor.
Ground floor.
Ground and first.
Okay, so perfect, because now this is an international hospital that is domiciled in Nigeria. Now I'm saying that to drive home the point that compared to what may occur in other advanced climate, infections are still a major issue for us. So it will be nice to have the isolation facility close to the emergency so that you don't have to now carry patients on lifts up. That's one. 2, to make it functional so that you could now integrate HIV and TB services in hospital. Why that is important is that if you want to do VVIP services, HIV is an illness of stigmatization. So you have some highbrow people that also have this infection, and then you could have a patient coming for neurosurgery, for instance, and has HIV co-infection. So you should integrate the services. You can do it for a fee, as different from what you obtain other clients, but make it in such a way that they are integrated with the isolation facility that is on the ground floor, so that as patients come that you need to isolate for TB management, you could even manage them in the ground floor, and then those in the top floors that will now need HIV drugs, for their care as part of their services will also be carried along. Thank you.
Thank you very much.
All right. Thank you. I'll rush through this real fast. For the physiotherapist, yes, we have physiotherapy. It's on the ground floor. In fact, we have 3 areas for physiotherapy. We have one on the ground floor. We have another one in the wellness on the 8th floor. And when I mentioned the healing garden, I mentioned one of them for management and the other for patients and their relatives. So yes, we have a fully equipped physiotherapy department. Then waste management is in the basement. I couldn't run through everything. The facility is very big, it's very complicated, but yes, we have a waste management system in the basement. For infection and isolation, I agree with you. We have one next to the emergency, but we have also another one in the ward because isolation doesn't always mean infectious. But when it comes to HIV, we do not believe that HIV patients should be isolated. No. They've come to the hospital. That stigmatization has to end, right? So the system is one where those isolated are just those that we are suspecting. I mean, with what happened in 2020, what we are suspecting is near the emergency and is designed with negative pressure and all that. But the other isolation, we have 2 on the other floors where you could have it for tetanus and other issues. So yes, we've considered that. And so I believe I must have touched everything. So thank you very much, ladies and gentlemen. And okay.
Please, just to me, the Honorable Commissioner for Information has some, the delivery advisor first before the Commissioner for Information.
Thank you very much. Don't worry, Tia, mine is not a question for you. I just want to emphasize this before we leave. If you take a look at what His Excellency the Governor is doing, he's leaving no stone unturned in ensuring that every project in the state for which state resources has been expended, effort is made to complete. Presently, we have Ibom Icon Hotel, or the Meridian as we call it. It is being put together, while at the same time, the International Hotel and Conference Center that have been started along Odoma Way is also being done. These are 2 different hotels. The same way 4 Points by Sheraton had been completed. And so we also have in the health sector. It is important to emphasize that Ibom Multi-Specialty Hospital is not abandoned. What we have here is a value-added facility that is being established for specific purposes, for specific levels of care. Already plans are being made to also complete and take care of Ibom International or Ibom Multi-Specialty Hospital. I think we need to note this. Let me also express my happiness with the contributions that we've made, which gives me real reassurance that also we're having a good buy-in into this project. But please, if you have any further comment after this, you can always approach the Honorable Commissioner, Consultant, myself, or any of these persons so that their input can be included. That's the whole purpose of having all of us out here today. Thank you very much. God bless.
Thank you to Prof. Commissioner for Information, please.
Yeah, thank you so much, Honorable Commissioner, Professor, and Consultant, Dr. Sokrari. For me, I think I want to join in commending His Excellency, the Governor of Akwa Ibom State, for approving this health sector dialogue and asking that the Commissioner should get healthcare professionals to come and participate in dissecting this very important project. And from the presentation, the very robust presentation of the Ibom International Hospital, 350-bed facility with all of the departments expected, the presentation we saw here was rich and good enough. And we've had very robust contributions and participation. So this is participatory governance, in my opinion. This is citizens' involvement in the governance process and in the project delivery process. So I think from the observations gathered and from the contributions made, it appears to me that the medical community in Akwa Ibom State seems very comfortable with what we have seen here today. Is that the feeling?
Did I hear you? I can hear a yes, right? It means you accept this project and you think it's good enough for Akwa Ibom State. And we thank you so much for your contributions, and may God bless you. We thank His Excellency. Thank you.
Thank you very much. Just before we go to the next, like the delivery advisor said, we're still open to suggestions. If you're shy and you couldn't reach out, please send a message. It's the same one and only number that I had that I still have. If you do not want to reach me, reach Professor Moore. If you do not want to reach Professor Moore, please reach Dr. Osenobong Morgan. Immediately you reach any of us, including the PS, Dr. Etukudo, Dr. Pateshe, Dr. Yangudo, they are all members of the technical team. We would incorporate your suggestions. Please, we want this, we want to deliver what His Excellency wants, a world-class facility that we all would be proud of. And let me use this opportunity before we go to the next presentation to commend the team of consultants. I've seen Dr. Oba, I've not seen the others. Professor Eyoekpe is here. I saw Dr. Clement Iyan, Dr. Otobong, and about 27, Dr. Ekpene, Dr. Professor Nottage, Dr. Ned Ndafia, Dr. Chinawa. I cannot remember everyone's name, but about 27 or 29 consultants all sat together, Dr. Nwafo, and both Nwafo male and female. Let me say here that I must register His Excellency's gratitude and my gratitude, because we called every single one at short notice. It was an afternoon. His Excellency just told me, Commissioner, get all your consultants from the different departments to review the equipment and what they want from each of the departments. And I put a call across. Within 1 hour, all of these big consultants were all gathered at the EOC. We argued and argued till it was 6 a.m. Nobody blinked an eye. Everybody sat in that conference room from 6 p.m. till after 5 to 6 a.m. the next morning. When they now left, they went to work in UUTH and came back that evening for us to continue consistently for 3 days. I must publicly register our gratitude to them. So we've been able to come up with this because we consulted with the community and the community responded. Yes, Effiong, we had nurses and they were all involved in the design. Let me also say that everyone that needs to be trained will be trained. If the training requires that you are trained in Nigeria as a doctor, you will be trained in Nigeria. For example, there is no reason why you would send a doctor, for example, to go and train. If it requires you to go out, you will go out. But please, everything we're going to do will be very objective and it will be value-driven so that we do not waste resources. And that is why we are consulting with you. I thank you very much. God bless you. We'll take the next presentation, Ubon. Thank you.
Yes, please. The next presentation will be made by the Akwa Ibom State Emergency Medical Services and Ambulance Systems, and the Acting State Coordinator, Dr. Obot Jacob, is ready. Please can we invite him with an applause as he comes for this presentation. The Honorable Commissioner has directed that we take all the presentations at a stretch and then we come for the questions, please. I believe you have a biro and a piece of paper. Kindly write down the questions as it comes to you so that at the end of all the presentations, you would ask your question and direct it to the specific person that presented so that we can save time. Please, Dr. Obot Jacob.
Good afternoon, the Honorable Commissioner for Health, my boss, Dr. Ekem Emmanuel John, distinguished personalities, permit me to make mention of my teachers, medical elders, and colleagues here present, and members of other health professions. My name is Dr. Jacob. I am a medical consultant, a consultant anesthesiologist, and critical care physician, and the state coordinator of Akwa Ibom State Emergency Medical Service and Ambulance Systems. Yes, I will keep the presentation brief because we need your input for this agency to deliver its mandate. Next slide, please. ACISEMSAS was flagged off by His Excellency with the Coordinating Minister for Health on the 1st of March 2025. Our goal, our work is mainly to provide emergency responses to Akwa Ibomite and all residents, people resident in Akwa Ibom State, initiate stabilization, ensure swift transfer of patients to government hospitals in Akwa Ibom State. Next slide. I'm going to pause here and make a detailed description of how we work. This is our flyers that are available both in hard copies and in soft copies in different social media handles. And for everyone in this hall and people watching us live, you can scan that QR code. It will take you to a form where you can drop your comments, inquiries, and we will respond to it on time. My team of admin staff are also here and they can start the response now. So we have a toll-free line. What we mean by a toll-free line is that you don't need airtime to call those numbers. People have been asking us, why do we have a 11-digit number, not the regular 911-822? But I'm here to tell that His Excellency wants to have an emergency response unit which will comprise of the fire service, the police, and all, including the emergency response team, and they will have that short code. But we needed to start because this service was in dire need. The people of Akwa Ibom State was in dire need of our services. Currently, we have a well-digitalized call center. Our call center can track our ambulances and can provide a live video assistance to our medical personnel conveying patients in the ambulance. As I was seated here before I was called, have been notified that we have a pregnant woman needing our ambulances and a case of carbon monoxide poisoning in Oron. Of course, we know all what that means. If I need to intervene as an anesthesiologist, I don't need to make a phone call. I need to just go to our emergency operations center and watch how they are managing the patient live from Oron to Teaching Hospital, which is our designated referral center for that case. So our call center, we have 10 call units and we work 24 hours. We have 31 ambulances in our fleet. In that 31 ambulances, we have mobile ICU ambulances. What we mean by a mobile ICU ambulance is that we can transport a patient that is having an endotracheal tube that needs a mechanical ventilator. That is the ambulance that is available here for us. It was not brought for display of anything. It is providing services for us from the basis to any emergency, God forbid, that can happen here. So you can feel free to go and see the component of our mobile ICU. So we have 5 mobile ICU ambulances, 10 advanced cardiac life support ambulances, and the rest, of course, our basic life support ambulances. So I have said that the component of our ambulances, it might interest you to note that they have inverter, they are inverter enabled because our monitors must be powered. So all our 31 ambulances are inverter enabled. And we have at least 2 oxygen cylinders in all the 31 ambulances. We have automated, at least an automated external defibrillator, a suction machine, a multi-parameter monitor in all the 31 ambulances. And as a backup, each multi-parameter monitor has each of the vital signs we monitor the equipment as a backup. So we have an electronic BP machine, we have a pulse oximeter, we have a temperature probe, both digitalized and the manual, and then we have a random blood sugar machine in all our 31 ambulances. And we have emergency drugs and consumables in all our ambulances. As mandated by His Excellency the Governor and implemented by the Honorable Commissioner for Health, none of our ambulances is permitted to move without at least 2 medical personnel. So you feel free to stop and see. Anytime you see an ambulance on the road, we have at least 2 medical personnel in the ambulance to provide care. And our response time presently is 30 minutes. But the Honorable Commissioner has mandated us that we should look forward to decentralize our ambulances more to give a 15 minutes response time. Next slide. So what are the things that we have achieved within the short period? It might interest you to know that we have prompt emergency responses across the state. We have done over 450 medical emergency responses and transportation. And our key medical interventions, on the 27th of May, we had a tragic incident in the state where school children coming back from the stadium had a tricycle explosion. We responded, transported them to Ibom specialists, and managed them. We lost some, but we are proud to say that some of them are alive. We have some cases where people called our ambulances because of their roadwork to give a standby ambulance services, and we have them develop life-threatening asthma, which perhaps if we were not there would have cost their life, and we have intervened promptly before referring the patient to government hospital. We also ensured coordinated medical referral system within government facilities and medical emergency. I want to, on this note, thank the Chief Medical Director of my place of work, Dr. Meba Sibasi, and the clinic chairman, medical advisory committee, who will always provide space when we bring emergency cases that require teaching hospital intervention. They will always provide that. I also want to tell everyone that we are providing currently, according to the initiative of the federal government, free transportation service for pregnant women who are in labor, pregnant women with medical, any obstetric emergency, and neonatal emergency. The government is providing free transportation for these women from their houses to either a primary healthcare, designated primary healthcare centers, or which are the BMOC centers, basic emergency medicals and obstetric centers, or the CMOC centers. We have 2 CMOC centers now. We provide those transportation, and it has been seamless. So I want to urge all our stakeholders to inform the populace of the members of our population that they should benefit from this. And we have commenced open air campaign and we are targeting to do that in all 10 federal constituency. Last week we were in Oron, and we had a good response from the people of Oron federal constituency. Our projection is to commence interstate transportation of patients. We know very well that there are some patients that will require to be transported to higher centers like the National Orthopedic Hospital in Enugu. We have made the plans, and we are now ready as an agency to offer those services, even though for a fee. And we cannot shy away that the commonest requirement for emergency will be on our highways. We are projecting that very soon we should have our ambulances man the major highways in Akwa Ibom State and the dreaded Kalabaitu Highway. We will provide those services that you can safely enter a bus and go to Calabar, knowing too well that, God forbid, if something should happen, we are just a call away and very close to you. And then we want to see how we can bring in our local government chairman to also provide medical emergency response team in all the 31 local government areas. So our prayers, next slide please. I want to also stand on this point to thank the Honorable Commissioner for Health for bringing this to reality. I don't think that there can be any other platform in which we can have advocacy meetings other than this. So I want to beg all the stakeholders here to be involved. ACCEMSAS is a unique dream and it is going to work for the benefit of Akwa Ibom State. So I want everybody living here to be involved and reach out to ACCEMSAS, make useful contributions in terms of suggestions for us to improve our services. I want to also beg my colleagues, especially those working in government facilities from the primary health care to the secondary health facilities. And let me also, at this point, thank the Chief Medical Director of Ibom Multi-Specialist Hospital. He has never asked me about how we are going to foot the bills of patients that we want to transfer to Ibom specialists because of lack of bed space in here. We will solve the problem and then we'll talk about money later. Thank you, my teacher, sir. And then we are planning to, another prayer is that we ask that the citizens of Akwa Ibom State should trust His Excellency. It is a dream that must work, and we have to do everything to make it work. On that note, I conclude by saying that ACCEMSAS is an initiative of the state government, and it has come to stay and outlive this administration. Thank you very much.
Thank you very much. I know the ambulance service is one that a lot of people have questions for. But before we take that, Professor Emembasi is on the National Management Committee. So I'd like for him to just make a few comments and keep it short.
I will be very short. Let me especially recognize the commissioner. Thank you, even though he's my friend, my brother, but you're commissioner. So no, you're not my boy. You're a man. You're my man. All the other commissioners here present, members of the House of both national and state, distinguished ladies and gentlemen, I want to say that Akwa Ibom has never had it so good. With the synergy right now with the federal government, Senate President we have, and we have a state governor who is very highly regarded at the center. And right now, I would tell you that virtually every federal establishment in the state is totally willing to work with the state government. I'm sure you can see with the number of people from UUTH. I would tell you, Commissioner, you're the lead health. I'm at your service. You command. I have once a Commissioner of Health, so you are the Commissioner of Health, you are the lead in terms of all of us work under you, whether we are federal or state. Now, but just to say a little bit about the emergency, like you said, I have the privilege of serving both on the National Committee on CMONC, the Comprehensive Emergency Maternal and Newborn Care, CMONC, and also NEMSAS, the National Emergency Medical Treatments and Ambulance Scheme. I head the standards and quality in that scheme. I would say that as of the 1st of this month, we have activated in UTH. Based on that, every road traffic accident, gunshot injuries, emergencies in children under 5, poisoning, there's a fifth one, are entitled to free treatment at NHIA rates at the University of Uyo Teaching Hospital. Now, we'll work to ensure the state also activates, as well as ambulance services you call. So we'll work with the state. We, unfortunately, because you do not have enough ambulances, we are supposed to be able to call every basic life support ambulance. You're entitled to 30,000 naira. When you go and pick advanced life support, 50,000. So we will work with the state SEMSAS because we don't have enough ambulances. So if the few I have, if I start using it, they will break down. So that's the most important thing. Then for the CMONC, we need to understand, a pregnant woman does not have to die anymore in this state. I'm happy. At the last I saw that there are about, is it 3 centers? Because I saw 4 centers in the state, including me, have been activated when I looked at the dashboard. Yes, no, what has been activated? I saw 4 centers from Akwa Ibom. That means there are 3 that are active. Now, every obstetric, can you read my lips? Every obstetric emergency that the patient is indigent, that's the word that we have to establish that you're indigent, is entitled to free treatment, irrespective of what. And we're also now trying to see how we can also ensure that children, that's the babies born, that has not, it's just this month that we're having the conversation of activating, because it doesn't make sense for you to bring a woman, the babies are asphyxiated, right, and you don't offer, but also the children. So if we work together, no woman needs to die. We can actually achieve 0 maternal mortality in Akwa Ibom State if we work together. So I would want to say thank you, thank His Excellency. His Excellency has been very supportive of University of Uyo Teaching Hospital. By the grace of God, we are doing a lot of renovations courtesy of him. I want to say thank you. He provided the resources. And we are also rapidly expanding our emergency services. I mean, you see that we've built a new accident emergency. And just last week, we had groundbreaking for a new children emergency, because when we know that the scope is a lot, we're going to have to face a lot of patients. So we are doing that. And I'm sure the commissioner would also be very happy to hear that. I was just telling Dr. Tugudo that we've been designated a regional diagnostic center, and funds are being provided for a new CT scan, MRI, fluoroscopy, and full laboratory services at the University of Uyo Teaching Hospital. And we've also been designated a regional mother and child center. Money is coming for an entirely new maternity complex. So, I mean, all these things would not have happened if we did not have the synergy between the federal and the state. So I want to say thank you. Commissioner, we are totally at your service. Thank you very much.
So we'll also let the House Committee Chair on Health say a word or two.
Ladies and gentlemen, please, we invite the Chairman, House Committee on Health, for his remarks. You're welcome, sir.
Thank you. The Honorable Commissioner for Health, Akwa Ibom State, members of the State Executive Council here present, invited guest stakeholders in the health sector, good afternoon. My name is Moses Essien, and by special grace of God, with me here is the Deputy House Leader of Akwa Ibom State House of Assembly. I bring you greetings from the Speaker and members of Akwa Ibom State House of Assembly on this very important, innovative initiative of His Excellency Pastor Umoino. I use this medium to thank the Honorable Commissioner for this wonderful assembly. Last week, or this week, we were invited to appear in the House of Representatives Open Week. And the essence of having that Open Week was to give the opportunity for the electorate that sent their representative House of Assembly to the House of Reps to have interaction with their various representatives, have opportunity to appear in the chamber of the House of Reps and participate in discussing issues, burning issues that affect Nigeria. Today, first, in the history of Akwa Ibom State, having served the House of Assembly for 2 years now, this is the first time I've seen a sector, a very important sector that has to do with human life, having opportunity to organize a town hall meeting where all the stakeholders are invited to brainstorm on issues that can help to strengthen the health sector of Akwa Ibom State. It's a big plus to His Excellency Pastor Moino. I also understand that for the first time in the history of my life, engaging the political activities and political scientists, that the governor of the state would have the passion to follow up his blueprints embedded in their rights agenda. And as far as the health sector is concerned, he has appointed a compatible team player who is ready to carry the vision of the Arise agenda on the health sector to reality. The Honorable Commissioner, you have done well. What you are doing here is democracy in action, because you cannot succeed as a commissioner when you want to talk about bringing another important and international hospital to the state without engaging those that will be able to participate in this kind of engagement. And so what you are doing is democracy in action, where the people are invited to come and share the vision of the governor. And so for you to have international hospital in the state, you need to get opinion of critical stakeholders. And this is essence, one of the essence of this stakeholders engagement. Let me also say it. The idea of having IBOM, International Hospital, have received the blessings of the Akwa Ibom State House of Assembly. I look at the fact that many of our citizens are going out of the state for medical services or medical tourism. Why can't we have one in Akwa Ibom State? When I approached the commissioner on this issue, what is happening with the IBOM specialty hospital? Why the need for another hospital? And I also explained it to this gathering, why IBOM International Hospital need to bed. And so he has shared the vision here for everybody to be on the know. It's not that the IBOM Specialty Hospital is going to be abandoned. No. Rather, it's going to be more strengthened. It is not going to be an issue where you have only one specialist hospital in the state. IBOM International Hospital might be a complementary hospital that can attract other personnel outside the country to visit and help to strengthen our health system. Let me say it here, Honorable Commissioner. In the budget of 2025, the Akwa Ibom State House of Assembly make a provision of 70 billion for the health sector. And when we talk about the percentage allocation in the annual budget of 2025, the health sector has 7.3% of the total lump sum of the annual budget. Honorable Commissioner, I want to believe that this particular engagement, by the next time you appear before us, we would like to know, this is July, how many percentage of fund we allocate to the health sector have you been able to attract? How many have you decentralized in terms of going to those in malaria, those in HIV, those in various sectors of the health that are involved? How many of them have written for release of funds and you are giving to them? Because that is the best way to strengthen the health system. When we approve money for you, please assess the fund and get every sector of the health sector activated and working very well. The reason is that very soon the House of Assembly might engage you to ask you questions about the fund you have attracted to various sectors that borders the health sector. Lastly, distinguished stakeholders, we need to appreciate the governor for this wonderful town hall meeting. The one behind it is the Commissioner for Health. I am of the opinion that this stakeholders' engagement will help to strengthen our health sector in the state, make a robust development that every personnel who work in the health sector should be happy at any point in time a call is made upon them to engage the entire Akwa Ibomite in terms of rendering their services willingly and without any cost to regret how much they are going home with. The health insurance is working. I want to say with boldness that first in the history of this state, in less than 7 months, the health insurance was inaugurated and they can attract a national recognition. It shows that the people appointed into various sectors of the health environment are doing very well. And so I appreciate the chairman of the Health Insurance Agency, I appreciate the commissioner, and I believe that as we leave this place, we will leave well equipped to continue to render our services to strengthen the health sector of Akwa Ibom State. Thank you and God bless.
Thank you. The Honorable Commissioner, ladies and gentlemen. Well, I wouldn't have had to say anything after the chairman of the House Committee on Health said all that he had to say. But as a member of the committee and being part of this great event today, I think I wouldn't have had to leave without saying one or two things. But first, it's like a commendation. What I'm seeing here in the health sector is what we've been yearning for. I'm very happy to hear from the immediate past Commissioner of Health and even the CMD UTH, seeing how all of them are working together and listening to all the previous speakers talking about this project today. I mean, it's a very great thing to hear. Now, in the Health Committee in the House of Assembly, we have a chairman that for the first time is making sure that the health sector in the state is revived. And I can tell us that we are totally in support of this project. Honorable Commissioner, what I'm seeing here today has given us that boldness and strength to make sure we support all that would come from your ministry to us in the House of Assembly, as far as health is concerned. And if we continue in the way we are working, the support from all the components of the health sector in the state, from what I've heard here, we are looking forward to a health sector that we can count on a great future. Thank you, and thank you very much.
We thank you to Chairman, House Committee on Health, Honorable Moses Essien, and Dr. Nsidabaya Kata, member of that committee and deputy leader of the House, and also Chairman, House Committee on Economic Planning and Development. Honorable Commissioner, sir, ladies and gentlemen, before we move to the next item, permit me to acknowledge the presence of the state chairperson of the Nigeria Labour Congress, Comrade Sonny James, who is also a member of the State Health Insurance Agency. Please welcome him with an applause. He's there waving. Thank you so much, Comrade, for joining us. Honorable Commissioner, please, an announcement with your permission. The parent or guardian of a child with the name Precious Udwak Emmanuel, please. Your attention is needed urgently towards the end of the hall. Precious Udwak Emmanuel, that little child needs your attention urgently, please. Wherever you are and whatever you are doing, kindly suspend and attend to the child immediately, please. Precious Udwak Emmanuel is the name of the child. We move now to the next item on the agenda for today, and it will be a presentation by the Akwa Ibom State Health Insurance Agency. May I now invite the Executive Secretary of that agency, Dr. Igbemi, to kindly come up for his presentation. Encourage him with an applause as he comes. The Akwa Ibom State Health Insurance Agency is an initiative of the Umoino administration to ensure affordable health care to Akwa Ibom people. He will tell us more about this. Doctor, you're welcome.
Thank you. Good afternoon, everyone here. The Honorable Commissioner for Health and your colleagues, the Honorable Commissioner, Minister of Information, the medical elders here present, the chairman of board, particularly reference to the chairman of my board, chairman of Akwa Ibom State Health Insurance Agency, the health community here present, the chairman, House Committee on Health, and your members, ladies and gentlemen, I just have a very short time to make this presentation. I am Dr. Igbemi Ato Igbemi, from Eastern Obolo. I'm the public health practitioner. I'm the executive secretary of that agency. I'm also a permanent secretary in Akwa Ibom State Civil Service. To tell you how many years I have been in the service. Just as a background, to let you know that we have able hands. The governor has been very careful in selecting the right set of persons to deliver on his mandate. I want to thank the governor for engineering this. Internationally, stakeholders' engagement is something that is widely commended, gives you opportunity to get feedback. I have the opportunity to say this because the chairman of the House Committee has made my job very easy. For the chairman of a committee in the House of Assembly that is meant to oversee what we are doing, supposed to be very critical to make sure things work properly, coming out here to say health insurance is working. I think my job is made simple. Thank you so much, Chairman. Health insurance that you believe in is working. He was the first person to drag me to that place when he came on board, that we should come and talk to them and then to get their buy-in. Thank you so much, Chairman, for allowing that happen. Immediately he was convinced that the right thing was done. He has supported us. They have already made up their mind to bring in their contribution to help the insurance to work better. Now, I'm very happy, Socio-economic, for coming to do this. This idea makes our job very easy because you are looking now at the demand side and the supply side. The health insurance drive the demand side. The supply side, the health facilities. As long as they work and they work well, then healthcare service delivery in Akwa Ibom State will be top-notch. So thank you for what you are doing. Please, let's just run through it. I won't waste your time because the job has been done. Fine. Health insurance in Akwa Ibom State, the one that we run is the social health insurance service. And the consultant talked about it, talked about the fiduciary aspect and then the social aspect. We concentrate on the social aspect to make sure that we bring down the cost to what the people can afford. And the governor showed his support by being physically present on the 20th of September when the health insurance was launched. He came with his ESCO. He was the one that set up the board on the 1st of July. I inaugurated it the next day on the 2nd of July. Since then, he's given us a lot of support. To make the job easy for us, he made a promise of paying for junior civil servants. When the idea came up, we were surprised. We were talking about going to start deduction and then bringing in the public health, the public sector. He told us, please, I don't want so much noise. What I will do, I will pay for junior civil servants from grade level 0 or grade level 2 to 6. We no longer have 1. That's why I jumped to 2. So that you will use that to test run. If you get it right, it will be very easy for others to key in. And that has worked. He has spent the money for junior civil servants to assess care. He has also, on his own, paid for 200 persons in the local government when he was invited for a pre-medical activity. He saw the need. The people are assessing care now. We have a vision that drives us. And what is our vision? Is to make sure that we make health services accessible to every resident of Akwa Ibom State. Mark the word resident. Whether you are an indigenous of Akwa Ibom State or not, as long as you live in Akwa Ibom State, you have access to us. And once you key in into our services, you will get healthcare services based on the package that we have commenced with. And that is the product we sell. The benefit package is what we sell. And it is robust enough for us to start with. I heard the delivery advisor told us about graded, it will come up. But for now, the benefit package that we have is comprehensive enough for every Akwa Ibomite to benefit from. And that is what we market to the people. I want to tell you that just recently, there is an anorectal surgery that took place for a newborn child in the teaching hospital where the parents wouldn't have been able to pay. But because they were, they had already enrolled with us, the parents got enrolled, the pregnant mother got enrolled with us, the health insurance took over the management of that child under the vulnerable group, with the federal government partnering with the state government through the Arise Care is funding. The child is fine. I want to thank the management of teaching hospital, the UNIO teaching hospital. We are collaborating with them. If you are an enrollee of Akwa Ibom State Health Insurance Agency and you are taken there, they will give you care and then we pay. I'm so proud to say that recently we got information that they're the one advertising for us. Why? Because we pay promptly. And I want to tell you that majority of people that are coming, because it's now becoming very organic, people just troop into the place for enrollment. It is the health facility that is actually telling them, you are here struggling to pay. Why don't you go and enroll with Arise Care? The thing is working. We are seeing results. So it has become very organic, and that is made possible by the health community here. Now, the House Committee Chair talked about the award we got. I just want to surprise you. When we got that award as the fastest growing health insurance, because we were the last to join, a lot of people were skeptical. What have they done for them to be recognized? But when they look at the institution that gave us that award, some of them kept quiet. We didn't know. We didn't lobby for it. We were just doing our job. And they recognized, and the Honorable, His Excellency was very happy about it. He invited us to present it to him. As I'm telling you, as I'm right now talking to you, for your information, I have to give this. I'm supposed to have kept this, but I will make it very clear. We have been invited for financing conference in Kigali, in Rwanda. They said we should come and share experience, and then we should also come there to get more knowledge. It is actually organized by the African Health Financing Forum in conjunction with the World Economic Forum. So that is how far health insurance in Akwa Ibom State is going. In August, we are working with the Ministry of Finance to make sure that that is made possible. The thing that we started as a child's play, because of the visionary leadership of the governor and the health team he has assembled, we are being recognized. And that is courtesy of all of us here. The area the delivery advisor mentioned, because somebody asked a question here, whether or not the poor will benefit, he gave that answer. That's why I don't want to go there. One of the things that will make the poor benefit is the equity fund. It's been provided for in the law that equity fund be raised because health finances thrive on the pool of funds. So the governor is listening to us. We're engaging him. He has directed the Commissioner for Finance to look at it. And we are so confident with the effort of the Commissioner for Health, because they have been engaging him. We're so confident that that equity fund will be approved. And once that is done, please, Akwa Ibom people, rejoice, because we will expand our scope. We have other things. I deliberately didn't want to look at that because, as I told you, my job was made easy by the information we got here. I just want us to spend 1 minute, look at one of the testimonials. I don't know whether the media has it there. Please, put it up for them to look at it, and that will speak for us. Because the lawyer says the evidence speaks for itself. Well, one thing I can tell you is that health insurance, when you are getting it right, is not hidden. Because the people live in the community. We have the different packages, the basic healthcare packages, we have the informal sector, the formal sector. And I want to tell you that formal sector has already started. We've enrolled them. In fact, it was last week that we concluded enrollment at the local government levels. So, in the coming days, you will see all our civil servants come into the health insurance space. And we also have made provision for retirees. Because when I came on board, the first persons that actually invited me were the medical elders. They invited me to their meeting, and I was squeezed a bit. You know, when you stand before the elders, people who taught you, it wasn't easy, but I was able to escape. Because when I told them, look, there's provision, the governor has made provision for you. They are coming in, even retired permanent secretaries. Yesterday, some of them were in my office. People are enrolling. And I want to say here, please, let us take advantage of what is available for us. We have a robust ICT platform that can take the people of Akwa Ibom State. And the ICT platform that we have is also able to handle claims and other things that could create problem. So we don't need to go and do manual claims. That is why we're able to make this payment very quickly. For now, we have up to, are we ready? Currently, we have 70 facilities, healthcare facilities providing care for us, both at the primary and the secondary care level. And they are both public and private. I want to tell you that we have also sent out information for further accreditation. Some of you here probably must have had it. And if you have not, we'll ensure that you have it. Why we do that is because we want to make the process of accreditation very transparent, which is also our core value. I do not interject or influence what they do. We have a committee for accreditation, and we allow them to do it, made up of experts. When they go there and go through what you've done, and they feel that you are due for accreditation, they will do it and make sure. Okay. It's all right. Thank you very much.
Ladies and gentlemen, please appreciate Dr. Igbemi, Executive Secretary, Akwa Ibom State Health Insurance Agency, for that robust presentation of this very laudable initiative of the Umoino administration. Yes, Commissioner for Information, please.
Yeah, thank you very much, Dr. Igbemi. Thank you for that beautiful presentation on what you're doing with your Rice Care health insurance scheme. But there are certain things I think that people would need to go home with. And you rushed over those. For instance,
what's the enrollment like, and what demographics are we looking at? What are the weaknesses within that you have, and what areas do you think needs to be strengthened? You talked about partner hospitals and organizations and so on. Who are there? Because I expected perhaps that's what you ought to have displayed. Because people need to know, that have that information. People need to know the closest facility to them. And this is where deeper collaboration is needed. Because we need people to know those facilities. They need to know where they are located. It's not enough to subscribe or pay for medical health insurance. You need to find out which one is close to you. Where would you go to if you have an emergency? And so on. Those are some of the things we need to know. And then, of course, you outline your next steps. Because that will now help even the medical experts and members of the public to know what to do, where to go, what days. In your enrollment every day, is it online? These are all the information that we need to put out so that people know whether they can enroll from their homes or whether they need to come to your committee or whether they need to do it from their local government areas. Because we can actually broaden this web and this net if we do some of these basic things. We will now be able to say what number are we targeting. For instance, in 2025, what is the target number that we need to pull into the health insurance net in Akwa Ibom State? And what milestones, where have we stopped? How will we get to that number? Those are some of the things I think we need to include in this presentation so that people will have the benefit of that knowledge and take this information back to the people in their different communities to know what to do. Thank you.
Thank you very much. We'd like to invite Dr. Igbemi to please return to the microphone and attend to those comments. Ladies and gentlemen, this marks the beginning of the question interactive session, the question and answers. While Dr. Igbemi is responding to the Honorable Commissioner for Information, please get your questions ready so that immediately after he does, you can come forward here and ask questions or make some comments. Before I hand over to you, Sir Honorable Commissioner, please, the Permanent Secretary has requested that I announce that a child has been left unattended to by the mother. The child's name is Precious Udwak Emmanuel. Please, the mother's attention is needed immediately. Thank you. The boy is seated where you left him.
All right, let me just quickly add, for want of time and the lack of it, I would crave your indulgence that we probably would organize another town hall. We may not be able to take the remaining presentations. I'm sure I'm speaking the minds of a lot of persons. So, but what we're going to do is that all the questions you have, all the leaders, just take your seats, go upstairs, and then they ask the questions. So, Aki Semstars, Dr. Edika Nekwere, please help Dr. Inoata. She's a lady. Take her seat upstairs. And then all of you, please come up. It's not enough to be executive secretary. You must be accountable to the people, and they must be able to ask key questions, and then you should answer and tell the people what you're doing. Where I need to come in as the second on call, I shall come in. Let me also just add that I hope the chairman of the State Health Insurance Agency and the executive secretary remembers that in October, we had discussed, and I reiterated when I took over office, that by October this year, we must move our number of enrollees to at least 200,000. You know I'm not going to forget. I'm going to hold you to task. You better overperform than underperform. Please. So just apart from Dr. Igbemi, any question whatsoever about our hospital systems, how it's working, the things you have observed, the things you want us to correct, not just hospital systems, health systems, even as a staff, Ministry of Health, you take your file, they delay it for 1 week, bring it up here so that we will know and we will correct. We're not hiding anything. We want to hear your feedback and we want to take measures to correct those things. Thank you very much. Even if it is the PS that is the problem, bring it here. We'll attend to him. Thank you. HMB2, sir. PS, you'll be there too. Ibom Specialist Hospital. You'll join them. Thank you. Yes, sir. Respectfully, sir. You will join them. Thank you. Who else? No. Please assist them with chairs. Who is hiding? AK Saka. They say you should join them. So once we take the questions, they answer so that we don't have to do the presentations. That way we will address all the questions. Where is the chairman on the task force on anti-quackery? Director Medical Services. Please take your seats, join them. Where is the chairman of the task force for counterfeit drugs? Join them, sir. It is a town hall. All right, so keep a seat for Dr. Igbemi too, so that when he finishes answering, he sits. When they ask the next person, the person goes to the dais, gives his comment, and returns to his seat. Thank you.
All right. Thank you very much, Honorable Commissioner for Health. Honorable Commissioner for Information. The Commissioner has answered one of the questions. The target, he just mentioned 200,000 by October. That is what he wants to get from us. He has answered. That is what he just said. But for now, we are over 100,000. We are precisely 106,000 plus. Because as we are talking, if you key to the system, you will notice that enrollment is going on. Our enrollment is continuous. But sometime to meet up, we organize maybe 1 week or 2 weeks to accelerate it. And a lot of the things we do is hospital-based. Because when we enroll you within that hospital, already we tell you that, look, that is the hospital you should. But now that we've started the public sector enrollment, we go with the list of the hospitals. So as we're enrolling you, we display it. You now choose the hospital that is closest to you, both primary and secondary. So we have the list. I just told you that we have up to 70, and out of it, 20 is from the secondary healthcare facility, both public and private. Almost all our general hospitals have embodied. And before we do that, yes, now the process, I don't know whether they still have it.
What we can do, Dr. Igbemi?
Yes.
All right, so what we can do,
I didn't prepare to come with that list. Yes,
I'm happy you are honest that
Yes.
you did not prepare for it.
Yes.
Next time, prepare very well.
Okay.
But what we can do is, you can prepare that list, put it in form of, infographics, one-page infographics, and then we can also add a QR code to it. And then we can circulate on all the medical professionals platform, and also share with the Honorable Commissioner in charge of Ministry of Information. Okay. Once it gets to this man, it has gotten to Nigeria.
Okay, that will be done. Now, talking about enrollment, we are moving very quickly towards self-enrollment. Every logistics is on ground. The only thing that delayed us is remitter, because we want to use remitter. And they started it. We've done the demonstration so that you can stay in your house and enroll. But I think there's something going on with Zenith Bank. and one other bank nationally. They're the one handling it. So that is what delayed it. They are facing that. Once that is fixed, we will show it to the general public so that you stay in your house and enroll. You don't need to come to us and you make the payment. You know, for you to enroll, that is very easy. We can give you the key. But for you to access service, you must pay. That is why the remitter must be attached. So when you finish enrolling, you check, it will lead you to where you make the payment. And once you make it, the system will alert us. So we are going very fast. We started that already. The people who are to handle it have gone very far. I don't know whether I forgot another thing.
You didn't forget.
Okay.
Please, what you could do, if I were you, because
Yes.
this is a huge platform for you to market,
Yes.
you would have told them that the 18,000 per annum, if the people need to take that home.
Okay.
And then continue to let people know that this thing is not expensive.
Fine.
Yes, please.
Thank you very much. Now, that is very correct. Our premium is 18,000 naira per annum for 1 year. Now, His Excellency, in his magnanimity, said that we should give discount to encourage people. It was his own idea. So now what happened is that once you come as a group and you are over 10 in number, we reduce the amount by 1,000. So you pay 17,000 to encourage people. Now, if you are enrolling as a family of husband, wife, and 4 children, you pay 96,000 naira per annum. And if you break it down, that translates to about 16,000 naira per head. So that's what we do. And I want to also tell you that because of what is happening, we have a lot of people paying for people. The Accountant General of Akwa Ibom State paid for his own people. So we welcome that. And they are assessing care. A member representing Ibono, Eket, Esreket, paid for his own people too. And we have people from different parts. Last week we were with the House of Assembly and they vowed, they're not here, they told us that look, because of what is happening in health insurance, we will tax ourselves. We know what is in the law. We pass the law. We will tell our members to pay the money. And when they pay, make sure you enroll at least 100% for each one of us. And we are willing to do that. Just recently, I heard that they've started putting the money together so that they will pay to the health insurance agency. I got it right?
Yes, you got it, but I'm sure you may not be able to do this one here, maybe later. Because I asked you about the demographics, because it will enable you to know where you are looking at. Male, female, people with disabilities, and all of those type of things. But you can update that in your further, in your future presentations, so we can attend to others.
That comes, we have the vulnerable group, where we capture the children under 5, free of charge, pregnant women.
Excellent. You see, the public needs to know that you're capturing children under 5 at no cost.
Yes.
And then people with vulnerability. So these are incentive-based system that the government is providing. So these are things people need to know. That people or children under 5 are not paying anything that is free, totally free. So that's like free healthcare for people at that level. So I would urge you that next time you are presenting, please include all this data and incentive, because it will help even people within the industry to understand the incentive packages that His Excellency has made available, approved for you to give to the public. So that will help us. Thank you so much.
Thank you very much. And in case of surgery, as it stands now, we've had 20,600 medical consultation and over 50 vaginal deliveries, over 200 surgical interventions, including mammectomy, herniorrhaphy, cesarean section. So it cuts across board. Thank you very much. We have it in our flyers. So we have the flyers. So once we give you the flyers, you will see those things in the flyers. It's just because of time, I didn't want to go into that. And actually, we missed something. If we had that video, the things are mentioned in that video, because they just told us what they went through, how they got enrolled, and what happened to them. So sorry, apologies.
Ladies and gentlemen, please appreciate Dr. Igbemi. His Excellency, our dear Governor, is doing a fantastic job as Chief Executive Officer of Akwa Ibom State. And I know that this session has further enlightened you about the things His Excellency, our Governor, has accomplished in healthcare in Akwa Ibom State, from the emergency and ambulance services to the health insurance scheme to the other initiatives, to the Ibom International Hospital, to other initiatives with which His Excellency the Governor is bringing to bear. Ladies and gentlemen, I believe His Excellency our dear Governor deserves another applause from you, the Akwa Ibom people who elected him to do this job that he is doing. We shall take some questions.